sick days have nearly doubled since 2018, costing companies an extra £30 billion a year. New analysis by the Institute for Public Policy Research, the famous think tank, has shown that workers are reporting unwell on an average of 6.7 days a year, up from 3.7 days 6 years ago. Is there a new plague of minor afflictions crisscrossing the land, or did we become too accustomed to the sofa during the pandemic? Well, to discuss the IPPR's findings, I'm joined now by Dr. Jamie O'Halloran, a senior research fellow at the think tank. Jamie, thank you very much for coming in.
Likewise, thank you for having me.
It's not quite doubling, but why are people feeling the need to take almost double the numbers of days off in 2023 than they did in 2018?
Yeah, so there's an interesting point. So we are becoming a slightly sort of unhealthier sort of nation. We're seeing growing rates of obesity. We're seeing us lagging behind in parental and avoidable mortality. But the real problem we're facing actually isn't people going to work while sick. It's actually people going to work whilst they're ill. And this is actually costing businesses and the economy and sort of workers more money. So it's not a sickness problem. It's a sort of health problem that businesses are suffering with.
And are there greater problems, because I have seen figures previously, in the public sector than in the private sector? There seem to be more days off sick in the public sector.
So our analysis doesn't sort of break down by public or private sector, but like one point that I could do want to sort of make as well is that our sick days compared to other countries in Europe is far below. For example, Germany, for example, is a country that has, on average, the workers take 20 days off, whereas we're only taking 6 days off per year. This sort of shows that it's not necessarily sick days is the problem, it's a general health problem that is causing these
So what are the health issues? Because there are some very concerning figures on health and life expectancy in different parts of the country and on different income distributions. Yeah. Is this something you're seeing reflected in sickness amongst the labour force?
So again, we're unable to in this sort of analysis we're unable to break down by income. But what we do find is that those on the lowest incomes are less likely to have access to sick pay. So if you're in the lowest quintile, you're twice as less likely to have sick pay. And sick pay itself isn't necessarily quite a bad policy at the moment, just because it's £117 per week. So if you're a full-time worker, you're earning £3.20 per hour, and that's what needs to change. So we need to sort of support people to go from sickness into work. That's going to boost productivity in the UK, and then be good for businesses. Because
your concern is productivity and the £30 billion a year of productivity that's lost, and we've got a long-standing productivity problem going back really to the early 1990s. And do I understand your argument correctly that what you need to do is to have a healthier country, and then if people are going into work well, they will be more productive, rather than we're losing productivity because all these idlers aren't going into work?
Indeed. So we've seen a stagnation of predominantly since the financial crash in 2008, it's been unbelievably stagnant. And the only reason why we've seen economic growth actually in the UK is increasing labour supplies, people working longer hours, or there's more people working. And what we believe is that by creating a sort of healthier country, we're going to sort of achieve these productivity gains that otherwise we wouldn't be facing. And
what are your policies to make people healthier, and how do you balance this by allowing people freedom of choice?
So totally. So we in our report, I won't list all the policies we have in the report. It's quite a long, heavy report, but it's a business-backed plan. It's a cross-party sort of commission, and we have a number of policies. So the main aim that we want there are two main facets of it. So we want to support businesses that promote health. So we want to see businesses improve their job quality. So particularly around SMEs, we want to give additional support to SMEs to improve job quality. But then also the second point of that, we want to sort of one of our ideas is that businesses profit should be from solving the world's problems, not by causing them. So in that premise, we want to reduce the harm that we are sort of facing and fix the market failures that we exist. So junkie advertising to children shouldn't be the case. Making the internet a safe place.
And what about mental health as opposed to physical health? Because in terms of obesity, you can put sugar taxes on. I'm not necessarily in favour of them, but you can do things like that. How do you help improve people's mental health?
I think it's really challenging, and it's quite a great affliction into the UK. I think there's some really good research done by the Health Foundation, which actually showed that there's growing numbers of people from working age who are going to be diagnosed with anxiety and depression. I think the real part of it is we want to improve job quality. We know that sort of bad jobs are really bad for mental health, and that then leads into sort of more additional health problems.
But not being in work is probably even worse for mental health than...
Actually, in recent evidence finds that actually being out of work is better for your health than being in really bad work.
How do you define bad work? I'm very interested in that, because how do you define really bad work?
I don't remember the full facts of the study, but it's like low pay, low autonomy, inflexibility, these sort of characteristics.
And of the rise from 3.7 days to 6.7 days, how much of that is mental health, or have you not broken that down?
Again, this is information that we don't necessarily have, but it has increased. But it is important to know that the biggest thing is actually people going to
work when they're sick, when they're not very well, which they were told not to do during COVID, but they've gone back to doing.
Well, it could be part for many reasons. Like potentially, you could say working from home enables you to work more when you're sort of sick. Potentially, is one potential argument. But this is an area we don't haven't necessarily investigated per se.
Well, thank you so much, Jamie. It's a really interesting area, and I think one we will come back to.